I hope that you all enjoyed this video. I hope that it was very informative and helped you with any questions that you may have had regarding delirium. So what I'm going to do now is move on to the article summary. The article that we chose to write a summary on is called Clarifying Confusion, the Confusion Assessment Method. The basis of this article was to discuss an assessment tool that's used for identifying and assessing delirium. Delirium is oftentimes overlooked and misdiagnosed. Just as any other mental illness, sometimes the signs and symptoms overlap and we misdiagnose it as something else. With delirium, it's often misdiagnosed as depression, psychosis, and sometimes dementia. One thing that it is important to note is that delirium and dementia are not the same. They are two separate entities. Yeah, they may have the same signs and symptoms, but they are two different diagnoses. And people often confuse the two. However, delirium can occur in patients with dementia, and when that happens, this is called delirium superimposed on dementia. There was an article by Joanne Brooke that differentiates between dementia, delirium, and delirium superimposed on dementia. And I'll add it at the end if you guys want to read more into the subject. The main problem with delirium is that there are limited resources available for identifying it. After reading, I found that 32% of cases are unrecognized by physicians. So in 1990, there was a study conducted to develop and validate a standardized confusion assessment, which is known as the CAM. The aim of the study was to enable all clinicians to accurately and quickly identify delirium in all settings. So basically, delirium would be identified with everyone, not just individuals who work closely with individuals with delirium or who work in settings with high-risk patients. Everyone would come to understand how to identify and assess for delirium. The CAM was adapted from the DSM-3 because at the time that's the DSM that was available. And in the CAM, there are 9 clinical features of delirium that were specifically defined. It was important to specifically define the clinical features because they can overlap and sometimes get confused with something else. And the 9 clinical features that were identified were acute onset and fluctuating course, inattention, disorganized thinking, altered level of consciousness, disorientation, memory impairment, perceptual disturbances, increased or decreased psychomotor activity, and disturbance of the sleep-wake cycle. The CAM is particularly intended for use in groups who are at a high risk for the development of delirium. For example, that would be individuals who are in a hospital setting, nursing home settings, mainly elderly patients. And a new method that facilitates detection of delirium was developed and validated using the CAM. The new instrument and standardized diagnostic algorithm, it was shown to have high sensitivity, high specificity, and high inter-rater reliability. The CAM is something that continues to be a useful tool for assessment and identifying delirium. So here I have, it's like a little short condensed form of what a confusion assessment method may look like. And I want to note that the diagnosis of delirium by the CAM requires the presence of both features A and B, and the presence of either feature C or D. Before, in 1990, when they first did the CAM, it was 9 clinical features, and now they have condensed it down to 4. So for feature A, we're looking at acute onset and fluctuating course. We're focusing on the change in mental status. Does the abnormal behavior come and go? Does it fluctuate during the day? Is there an increase or decrease in severity? And for inattention, we're focusing on the obvious. Does the patient have difficulty focusing? Are they easily distracted? Do they have trouble keeping up with what is being said during a conversation? And with disorganized thinking, we're looking at the patient's thinking. Are they disorganized? Are they incoherent? One good example is, say there's an elderly patient who was in the war. Their mindset is stuck on the war back in the time when they were in the war. They're not in the present day. And for altered level of consciousness, we're just looking at the overall level of consciousness. Are they alert? Are they comatose, lethargic, and things like that? This is just a short snapshot of it, but usually with the form, the nurses or whoever is doing the assessment, there's a number of questions that they're asking for each category. The CAM continues to be a useful tool for assessing and diagnosing delirium because it goes beyond the bedside interaction with the patient. The CAM is focusing on different categories. It's focusing on different behaviors, and it's not just looking at one behavior and placing the patient under one umbrella. And one good thing about the CAM is that you don't have to be trained in the area of dealing with individuals with delirium to do the assessment. It's pretty user-friendly. Here is a list of national web resources to help further enhance your understanding of delirium. For the first link, the Nursing World link, it comes from the American Nurses Association. It gives more information to nurses on how to prevent, identify, and treat delirium. There are supplemental packets and PDFs that are really useful for nurses. And for the American Delirium Society link, it's sort of like the National Institute for Mental Health. This website gives a lot of information on delirium, how many people are infected, ways to get involved, ways that you can help. And for the NCBI link, the third link, it talks about the symptoms, and it talks about how to care for individuals with delirium. For the Mayo Clinic link, this link will give you the most information about delirium. You'll get an overview of delirium, the different types of delirium, how to prevent it, how to deal with individuals with delirium. You get a lot. And if you were to type into Google, this will be the actual first link that pops up in regards to delirium. Which brings me to my last slide for references. I would like to thank everyone for listening, everyone for watching. If you have any questions, feel free to ask, feel free to comment, and feel free to give feedback. Here are a list of some links if you want to look further into delirium. And I hope everyone has a great day. Thank you.